Hey everyone, welcome back to my channel. In today's video, I will tell you the process of healthcare recruitment in US staffing and how staffing agencies help hospitals and medical facilities fill their roles with qualified professionals. Let's get started. So first is understanding the healthcare requirement. This process begins when a healthcare client such as hospital, clinic, nursing home or medical group share a job requirement with the staffing agency. And this requisition includes job title, number of position, location and work shift, credential needed, contract length, pay rate or bill rate, target start date. So understanding these details thoroughly is critical before starting the sourcing. Next is sourcing candidate. Once the requirement is received, the recruiter begins sourcing candidates. In healthcare staffing, timing is everything. Many roles are urgent and require a quick turnaround. And candidates are sourced through job boards like Career Builder, Monster, Indeed, healthcare specific platforms, social media like LinkedIn and Facebook, internal ATS or candidate database, staffing vendor or sub-vendors, and through referral. If you're working with the travel nurses or locum tenens, you will also need to consider state licensing and credentialing timeline. Next is screening and pre-qualification. Once candidates are sourced, it is time to screen them. In healthcare, pre-screening is crucial because you must ensure valid and active license, required certifications, minimum years of relevant experience, shift flexibility and location preference, work authorization, pay expectation and availability, can relocate or travel if required. In US staffing, making sure your candidate is 100% compliant and market ready saves time in later stage. Next is submission to client. After screening, the candidate is submitted to the client. In healthcare staffing, this often happens through a VMS or MSP portal such as popular VMS platform like ShiftWise, IA Connect, Medifish, Beeline, and Focus One. And submission include updated resume, skill checklist, certification, license verification, references, candidate profile with rate, availability and location. And double check that all documents are accurate and properly formatted because first impression matter. Next is interview process. In many cases, healthcare roles, especially contract roles, may not require an interview. But for high-end positions like physician, therapist, or full-time hires, client may schedule phone interview, Zoom video calls, panel interviews. As a recruiter, coach the candidate in advance. Review the facility name, expected responsibilities, and dress code. Next is credentialing and background checks. Now comes the critical step, credentialing. This is where healthcare recruitment is different from other industries. Credentialing involves verifying license, certification, immunization records, work history and references, background check, drug screening, TB test and physical exam. Staffing firms use platforms like Profici, Checkers, eStaff 365 or Certify to manage this process. Next is offer letter and confirmation. Once the clients give a green light, the staffing agency rolls out the offer letter. Details shared with the candidate include pay structure, start date, reporting location, duration of the contract, shift details, orientation instructions, payroll and timesheet submission info. And the candidate confirms their acceptance and the recruiters start preparing for onboarding. Next is onboarding. Now then, the candidate goes through onboarding, which include paperwork, collecting signed offer letter and tax form, insurance enrollment, submitting timesheet instruction and point of contact info, facility instruction and parking info, confirming badge pickup or facility access. Next is post-placement follow-up. Even after the candidate is placed, your job isn't done. You need to involve regular follow-ups for check-in during the first week, gather client feedback, resolve issues related to timesheet or pay, extension discussion if the contract is ending, redeployment for future roles, offer bonuses or referral programs. Maintaining a good relationship with a placed candidate helps reduce turnover and increases the chance of redeployment. And that is the complete process of healthcare recruitment in US staffing. If you found this video helpful, do not forget to like, comment your question and subscribe for more US staffing insights. Thanks for watching and I will see you in the next video.